Welcome to the Sisterhood of Sweat. Today's guest is Dr. Kayte. Dr. Kayte Susse D.C. is a functional and preventative health expert who works with patients to optimize their health and feel their absolute best. Dr. Kayte became interested in studying biochemistry while suffering from mysterious health symptoms. So Dr. Kayte, she became interested in studying biochemistry while suffering from mysterious health symptoms, only 9 months after getting silicone breast implants. At the age of 27, she had led a very active lifestyle after just retiring from 9 years as a high school and collegiate All-American wrestler. A sudden onset of systemic health issues, which seemed to appear overnight, perplexed her. Both the allopathic medical community and several alternative medicine doctors she encountered had led her on this journey of self-exploration. A turn in her self-treatment came when she learned about heavy metal toxicity and the ingredients in silicone implants due to underlying genetic challenges in herself, which are very common. Dr. Kayte began working to understand the long-term implication of these exposures to the function of body systems and overall vitality. She believes we often face mitochondrial assaults from the environment, man-made drugs, and pharmaceutical devices. Sorry about that, you guys. I literally did not have my glasses on and I could not read the screen. Isn't that terrible? So I just found them. So we will have a better bio for the podcast itself, but hey, live and let live. So today we're talking about the subject of breast implants, and we're going to talk about the serious side effects that can happen when you have implants and the health risks and breast implant disease and what to do about it, what the symptoms are, and to get them or not to get them is the question today. So I am really excited to welcome Dr. Kayte Susse to the show. Welcome.
Hi, Linda. Thank you so much for having me. I'm happy to talk to you about this.
Oh my gosh. I mean, you are in my world where I have, a gym and I do fitness competitions and, fitness modeling. Women, seriously, I'm surrounded by women that have implants, and I really did not myself realize the serious health risks involved. And I would love for you to kind of start your story with how you were a wrestler, and I want to hear that part first.
Yeah. So in my bio, I talked a little bit about genetics, and I think it's important to mention that just because you have a bad gene mutation, which in my case, I have one that's pretty bad, it doesn't mean that it has to affect you negatively. Like, I went my whole life and I was, a very good athlete. I, was able to compete, train, not eat for a long time. I was fine, right? And then I got implants, and it turned on that bad gene, and it caused a lot of problems in my body. So that's a good place to start, because just because you have a certain gene mutation, I know a lot of people are doing 23andMe now, and they're doing a lot of other genetic tests, and you might see something that's not ideal. You might have a double mutation on something, but it doesn't necessarily mean that it's going to turn on unless your environment becomes very clouded. And I think it's important to mention in the health community and the community that you're in, that these are a subpopulation of people who are very driven, and they're the type of people who are still going to get out of bed and work out even when they're aching and tired. And they also, often when they get implants, they start to be like the healthiest unhealthy people around. It's like they're chasing, constantly trying to feel better, trying to do everything right, and still not feeling as good as maybe they should. And then you have to think about the fact that you can go out and have, drink alcohol a couple of nights a week, and then you sleep and your liver has a chance to recover while you're sleeping. But when breast implants are inside of your body, they're in your body 24 hours a day, 7 days a week. Your detox organs never get a break from, and especially if they have gel bleed or rupture, or even without they have a sweat component. So they are excreting into the bloodstream. Your detox organs do not get a chance to rest from that. And that goes on, every minute that they're in your body for years and years. So over time, it can definitely cause some problems.
Well, I just kind of find it fascinating as far as like when you're thinking about this. I know for my own aspect of can you get heavy metal poisoning from the saline implants as well as the silicone?
So the older saline do not have heavy metals in them. The issue with saline, the older saline implants is a little bit different. But now the new saline implants have a silicone shell. So it depends on when you got them. And the new saline face very similar challenges because a portion of them is made from silicone. So it's the manufacturing of silicone itself, which has like endocrine disrupting components. And then there's heavy metals added to the processing. It's like part of the problem that they had many, many years ago, like 30 plus years ago when they first made implants, was that they were not really sticky enough. They weren't holding together. So those women were getting this migratory silicone that would kind of disperse and degrade inside of their body. And then it can metastasize into the lymph. And that's why the FDA ended up taking them off of the market in 1992.
Right. And then they put them back on the market again.
Well, what they did was they added a lot more chemicals to make them more cohesive so that they wouldn't be like migratory, but then those chemicals have their own issues, right? I could go on, but I don't want to ramble on.
No. I mean, this is fascinating. So with the saline, how long ago did they change those to have silicone then?
I'm not 100% sure because I think that there's several companies that manufacture, so they have possibly different timelines for that. But my understanding is that it's very, very recent, like probably in the last couple of years. But okay. we can check on. We could check on that.
So we'll put that up in the show notes for anybody out there that may have them that's curious. Hey, am I at risk for heavy metal toxicity? I know you can get them with the silicone.
Well, and it's also an issue because saline implants, traditionally, we don't think of them as being like immune system reactive, whereas silicone we know is an immune reactor, which means that in addition to like its ability to, throw a wrench in your mitochondrial health, it can also turn on autoimmune disease, like anything that's immune reactive, right? So, I know some plastic surgeons who over the years have, which is amazing, tested women for autoimmune disease before letting them get silicone, and then have maybe, geared them towards saline. But now the new ones have a silicone shell, so that kind of goes out the window. And autoimmunity is something that the FDA has like acknowledged, and they list as a complication in their fact sheet about silicone, like that it's a possibility. I mean, they're not saying that it's a proven link, but they're saying that there's a correlation in that 1 in 300 women within like the first 3 years, which is where their study was done, can get anti-nuclear antibodies, which is a marker for connective tissue diseases like lupus and other diseases. So it's something that we know happens. But then it's like they say, well, autoimmune disease is a lifestyle disease. So how do we know that it's not like lifestyle changes in the women with implants? Like maybe they got implants and then this is actually what they said. Maybe they changed their behavior and they were going out more and the phone was ringing and they were having more partners and it turned on autoimmunity. Like that was actually one of the counter theories for why the autoimmunity appears.
What are some of the symptoms that women would notice that actually maybe they don't realize? Because you said, like with competitors, we're working out and we're used to pushing through soreness and achiness and tiredness, and I think a lot of times we might think that it's just our workout, it's just our diet. How do we know the difference? So
what else? So if we go back to what I was talking about at the beginning, it's really important to explain this. And I know it sounds really broad, but you have to think about it from a genetic position, okay? Like everybody is uniquely different genetically, right? Everybody has their own ability to break down in a very specific way. So let's say you take that person and you make them an alcoholic or you make them a drug addict. Like you can see different types of diseases manifest based on that person's predisposition. And it's the same thing with having these things inside of your body, because again, it's throwing a wrench in overall health. So for that reason, many vast symptoms across the board can be attributed to the implants. However, there are certain things that are really common among more women. So I can talk about like what happened to me, but we see a lot of weird wild card symptoms that are not necessarily everyone's getting, but people are getting them and then they explant and those things resolve. Obviously, like there's other things that you need to do. It's not like you just remove them and then you just are immediately fine. I mean, if you've turned on certain disease processes, like it's good to work with somebody who can give you like a whole evaluation, right? And like help you support those specific things. But in my case, I don't have autoimmune disease, like I genetically, whatever, not predisposed so far. I haven't had any autoimmune disease happen, but I had this really awful pain. Like I remember I was working out with a trainer and I just started to have so much pain post-workout, and it was so strange because I had been pushed really hard by coaches over the years. And I know what it feels like to be very, very, very sore. There's a discomfort element, but it doesn't feel like your body is breaking down. It just, you might feel really sore, but you don't feel like it's like some kind of pathology. And this felt like a pathology. Like I was aching so bad. I needed to take ibuprofen. I could not sleep. So obviously I stopped working out because I wanted to see it. And then I noticed the pain was still there. I started having neurological symptoms. I had almost immediate alcohol intolerance. A couple drinks would make me just like violently sick. And that was for me in the beginning. And then that just sort of turned into like an ongoing pain sort of cycle, like a fibromyalgia type situation. A lot of women that have silent ruptures in their silicone get diagnosed with fibromyalgia. That's another correlation. Things like heaviness in the head, brain fog, GI symptoms, those chemicals can interrupt the gut. They can act like they can they can mimic hormones and block receptors and cause hormonal shifts, especially in the detox process after you remove them, which is something that it's important to talk about because once you remove them, there's a whole kind of road ahead of you to feel better. In my case, I also it was really, really interesting. I was pre-diabetic, like as an athlete, vegetarian. I'm not a vegetarian anymore, but I was my whole life up until breast implants made me very sick. And then I started learning and changing things. But I was pre-diabetic. So my theory is that because we see in diabetic population that they have less mitochondria because basically the mitochondria, they start to like die because the cells turn over faster because of the diabetic process. And that's one of the reasons why energy is compromised, because mitochondria is where your energy cycle happens and where you produce ATP to feel alive, right? And move in every process that you do. So in my case, I believe I have more cell apoptosis, more cell death, less insulin receptors, less ability to uptake glucose, and therefore higher blood sugar.
Oh my
gosh.
Okay.
Like not diabetic high, but like pre-diabetic range, lab range pre-diabetic. And all of the doctors I had were like, we have no idea why you're pre-diabetic. And it resolved instantly after explant. So
and you had a good diet. So
oh yeah, I was doing HIIT exercise because I know how to reset. And so I was already studying functional medicine during that time because I had implants the whole time I was in school, trying to figure out why I didn't feel well. And becoming a chiropractor, thinking it was a musculoskeletal problem, and then realizing that those interventions didn't make me feel better. They do now, but at the time, like you're having full body pain, like everything's aching. The adjustment, no, it didn't help me. Acupuncture helped me a little bit, but it was like very short term, and it was like all the time I had to do it, right? It's like a constant swimming upstream. So
walk me through what you were feeling like and when the light bulb went off in your brain that it might be implants.
Well, it's so funny because I had known that silicone was immune reactive. That was one of the things we learned, about like latex, silicone, things like that. I just never associated it with my implants. I didn't know that they had all of those heavy metals. I didn't know they had mercury and lead and arsenic and platinum and aluminum. And I just thought, okay, silicone is immune reactive, but I don't seem to be reacting. So like no big deal. I didn't know about the heavy metals. I did know that I had this mitochondrial defect on SOD2, which is an enzyme inside the mitochondria that helps like remove free radicals. So every time your cells do their energy cycle, this enzyme breaks down that metabolic waste and then pushes it out. Okay, so if you have less of that enzyme, that's why the cells are dying more, because they're getting overloaded with basically their own their own free radicals, to simplify it. So I knew about that. I also knew that heavy metals and chemicals interfere with the mitochondrial function, but I didn't know that implants had it, right? So then I was at a functional medicine conference in Colorado with Dr. Brandon Lindell, and it was like an immunology conference, and as a student, and he just like very quickly mentioned like a study where fibromyalgia diagnoses in women with silent silicone ruptures, and that was the light bulb. So I went home, and I had one of my implants had been behaving strange and for years, and I called my plastic surgeon when it first started, and he was like, oh, just massage it, whatever. So I went and got an MRI, and the MRI said that my implant was ruptured. So then for me, I was like, okay, well, that's what it is. But when I took them out, it actually wasn't ruptured. It was folded in half. Okay. But it doesn't matter if it's ruptured or not. I think if it's ruptured, things could be worse, but they can still be really bad without a rupture. So that's an important distinction to make.
So it could be leaching. Was it leaching? Was it leaking?
Yeah. So that was another thing too. So like we took them out and they were really sticky. And Dr. Chung, who was my explant surgeon, he cleaned them and the stickiness came off. And then we put them in like a bag, like a cool bag in a, safe storage spot. And then a couple of days later, they're sticky again. So they are sweating. And that's actually something that the FDA talks about, that we know that happens, that implants sweat, okay, whatever their contents is. And the FDA says that they've tested the contents and that it's clinically insignificant. So, but I don't really know how they came to that conclusion, and how they could quantify over years in somebody's body under heat. And then there's people who have worked, like in Canada, there was a physicist, he that works with one of the companies, and he's, has a theory about how the capsule tissue, which encompasses, like basically surrounds the implant, that there's like an acidity change, and then that can degrade the shell. I don't really think that they were testing the sweat with like the human body scar tissue capsule made around it, like under the heat of the body. Like, I just don't think that that's how they tested it to come to this conclusion. So.
So what creates the capsular contraction that women experience many times with breast implants?
So the predominant theory, which relates actually to this large cell, this lymphoma that we're seeing, this breast implant associated lymphoma that we're seeing, is that there's pathogen activity inside of the capsule. So there's like basically low grade infection, which is what causes the capsular contracture. And that's why a lot of times surgeons will say, oh, you have a capsular contracture. Like, let me do another surgery on you. They just didn't do it right. Like, let me do it with my technique and it'll go away. And then you see these women that have had 1, 2, 3 surgeries and they just keep getting capsular contractures. And it's because of that pathogen activity, most likely. And it's the same thing with the breast implant associated lymphoma. The reason why we think we see it more with textured implants, although it can be associated with all implants, regardless of texture. That's a quote from the FDA. The texture itself attracts more pathogens. So we think that that's why these women are getting that type of cancer.
Wow, that's pretty serious.
Yeah, it's pretty serious. And it was Finland, Finland did a population study in 2010, I think. So that study from 2010 basically proved on a really large scale that textured implants are causing this type of lymphoma that we've only seen it in women with silicone textured implants or implants. We've now seen it with a case of a butt implant as well.
Oh yeah, I heard from my son today who said that some people are dying that get butt implants.
So one of the research studies, the patient died within a year. Yeah. There was a case report about her butt implant.
Want to look good, but not 6 feet under. Right? Like seriously, I mean, you know,
well, that's the irony. Yeah, that's the irony, is that people are getting these to look better, and it ages you more than anything. It ages you more than smoking, I think.
That's the irony. And I think just knowing that you're enough as you are, and just, you know, if you want to slap some makeup on and maybe, you know, I don't know, get some highlights. I mean, it's even that could be like unsafe, but it might be a little safer than getting implants.
But you understand that it's not, the highlights are not next to your heart and your lungs and your vagus nerve. Right.
Yeah.
But like I think back and I'm like, what was I thinking? Like, just think about the geography of where they are. Like, what is
next
like
to your heart, next to your lungs. Right. Oh my gosh. And I remember like, you know, several women that I've known, like, were exceptionally tired, exceptionally exhausted. Their joints were aching. I imagine they probably had, I'm just guessing, maybe some fibromyalgia.
Right.
And then, you know, one of my friends that was on the podcast before this, Miss Bikini Universe, had her explanted because she did get breast implant disease, which you know, was causing her serious health risks. And so a lot of people are getting them explanted. Like,
a lot of people are, and it's all because of like the work of women, like what you're doing, what I've been doing, speaking out, Healing Breast Implant Illness by Nicole, which she started the Facebook group. There's other women who have started groups that are cancer survivors, advocacy, social media influencers. It's kind of cool because a lot of these women who are really famous for being attractive and hot, like model, and then they're speaking out, which is great that they could use their platform, you know. So
yeah, I mean, and it's not just that. I mean, it can be other forms of, you know, of plastic surgery, fillers that,
well,
you know.
I think it's important to like talk about those things individually, because I get my lips done. I think that hyaluronic acid is safe. There's obviously always a risk.
Yeah, depending, right?
Yeah, there's risk with any like needle or any type of medical procedure, but that's very different because the informed consent, it's like, yes, you might get a bruise. Like, yes, there could be like there could be an issue in this area, but not like, oh, your entire life is you're going to be bedridden. Right. I mean, these women who they could afford to get implants and then they get so sick that they can't work, and years down the line, and their families are deteriorating because of the strain and the stress of chronic illness, you know, in the home, and then they can't even afford to explant. And it's like, sometimes their partners aren't supportive because they've had a strain on their relationship. You know, it's like hard to be like a good mother and a good partner when you feel horrible all the time. And it's also really hard when you're not getting like any support from outside, like people are treating you like it's in your head, because they can't find
well, I'm sure that's a $1 billion industry, and doctors aren't wanting to say that, oh yeah, it's probably your implants.
It's also hard, like if you go to your medical doctor with like certain issues, like sometimes they'll test you for certain autoimmune diseases, but it really is dependent on how much investigation they're willing to do, how good your insurance is. And then in my case, like, yeah, the pre-diabetic thing was like the only thing that was a little weird, but I didn't have anything else abnormal on my labs, like nothing. I mean, we didn't do fancy like mitochondrial and micronutrient. I didn't go that far. I was a student. I didn't have, you know, thousands of dollars to spend on those types of tests. If I had, we probably would have seen irregularities, but then it would have been like anybody's guess as to why, or what was, you know, what am I supposed to do? Just try to be more healthy, like, which I have to say, like, became my full-time job, like just swimming upstream. Yeah.
So when you got the explant, I mean, you know, I know when I had my fillings, I had them taken out because I had sulfuric mercury leaching into my bloodstream from my fillings, because they used to put them under the gum. And I had to go to a biological dentist to have them taken out the right way, because it could have caused me more damage getting it out. How do you do that with implants?
So it's the same concept. And this is such an important thing. And anybody who wants to explant, like I highly suggest that you go to our Facebook group, which I mentioned earlier, and you can put it in the notes, but it's Healing Breast Implant Illness by Nicole, because we have lists of surgeons that we know women have had experience with, and they vet all of them, and they have surgeons everywhere. And these are doctors who understand how to explant correctly. So like most plastic surgeons will be very defensive, and they'll tell you that of course they know how to do an en bloc capsulectomy because that's the name of the procedure. But the thing is, just because they might have learned about it in medical school or they remember the term doesn't mean that they're doing it often. And it's a delicate procedure where they have to go around and they have to detach that scar tissue capsule from the pocket of the breast. So that involves going very close to the lungs, scraping off the rib if they're under the muscle, right?
Okay.
And they have to really, really be on board with understanding that scar tissue capsule has to all come out. So if they just act like maybe you get the feeling that they're not taking it seriously, like that's not your surgeon, because that scar tissue capsule has been in there absorbing all of that sweat and possibly rupture for years, right? And that tissue is really toxic and it will not reabsorb. So if you remove the implants and you leave that tissue in there, which most plastic surgeons think is acceptable, they think it's fine. They think it adds volume and it's no big deal. It's a really big deal. So women have had second surgeries to remove capsule tissue that was left behind by surgeons who were not understanding the importance of that. Okay. And then in addition to that, the practice aspect, because if you have a rupture, so when silicone ruptures inside of the pocket, inside of the capsule, you don't know. So if you cut into that while it's still in the body, because that's how they like to do it. They like to just cut through the skin, then cut through that little capsule, which is an envelope around it, right? And then just pull the implant out and just leave everything in. And then that's how they usually do a removal. So if they cut into that and it's ruptured, then it's rupturing inside of the pocket, which means that silicone is super sticky and it'll stick to everything it touches. And then it goes into the lymph nodes and you can't get it out. I mean, once it metastasizes into lymph, it's like, I mean, you can cut out some of the lymph nodes in the area, but it's, that's a problem, right? That's what you don't want happening.
So with saline, what is the difference? What can saline cause? And what should women look for as far as if they have saline implants?
So the problems that we see with saline are a little bit different. I know women who have been very, very sick from their saline implants, and they have had a lot of the same symptoms, but it can be like a different mechanism. So with saline, we have a valve. That's a valve that gets filled with saline and then sealed, but it's a man-made thing. It's not a perfect mechanism. And we've seen a lot of women when they pull those out that they're filled with mold. So the actual saline will become polluted. Now, it doesn't mean it happens in every case, but
just in some, or
yeah. So I mean, like, it's something that we've definitely seen. That valve can become permeable. You can develop this. I mean, can you imagine having black mold next to your vagus nerve? So they're getting a lot of these histamine symptoms, mast cell, allergy responses. It can turn on autoimmunity as well. Just the shell of the old day. It's not as predominant as with silicone, but we do see it. I had a girl, Crystal Aguilar, who's a model who I had on my show a couple of months ago. She had saline implants and was just diagnosed with a mysterious connective tissue disease. They didn't even know what exactly it was because it wasn't fitting like any particular exact disease, but she had markers and she felt awful. She had saline. So,
So the mold is inside of the implant or outside in the body?
Inside, okay. inside, because it's a bag filled with a water, like salt water. Okay. So yeah, it can become, wow. So when that valve is just slightly permeable and little pathogens can get in there, they can grow. And then over time, they're just encapsulated inside of that bag. So they just it's like a fish tank.
Wow.
Wow. If you've ever had let your fish tank sit out for a couple weeks.
Surgery? Because, I know women, we get the implants, we want to feel attractive, we want to feel sexy. And then, you are feeling like crap and you've got to get these implants out. What is the alternative then when they get them out? What kind of surgery can you have to still keep your breast looking attractive?
Yeah. So if you've already had children, I think getting a lift is like the best move. You can get a lift and embrace smaller breasts. I've seen a lot of post-lift explants and they look amazing. I mean, they look great. And that natural look is beautiful. And that return to that, and in myself, like, I'm so happy. Like, I didn't get a lift because I haven't had children yet and I might want to. So when you get a lift, you move the nipple, which makes it possible that breastfeeding might go off the table. So that's why usually, but you could still, people still do it. So there's also other options. There's fat transfer, which can happen. You can move fat from another area to the breast at the same time. But if you're having a lot of health challenges, like I would not, and the surgeon you will talk to, they'll go over this with you. I don't think that that's the best initial step is to go, because fat transfer has a lot of risks and it's also a lot more invasive. You're doing liposuction in one part of the body. So if you're going through health issues and that's your reason for explant, I wouldn't immediately do a fat transfer. I would probably wait. But then if you wait and then you eventually, if you really feel like you need that enhancement, there's also stem cells that you can add in with the fat, which can proliferate the fat. And because sometimes women lose fat when they do the fat transfer. So they'll do like this big transfer and then in 6 months, the fat has decreased a lot because you just can't control what happens. You just don't know. Yeah.
So with, let's say that you had size double D, is the skin going to snap back or do you think they're going to need to get like,
I think everyone's different. And that's kind of why, I'm not a plastic surgeon, but I know when you consult with one, they'll talk to you about your options individually. But yeah, like when you get a lift, they're obviously trimming the excess skin, but your breasts absolutely tighten up. I mean, I didn't do any lifts and anyone who's interested, you can go in my breast. I'm just kidding. Women only can go in this group, but there's tons of before and after pictures. And a lot of women, like within 1 week or 2 weeks or even a month, they're so depressed about it because they think that they look awful. And all the supportive women are like, no, just give it time, just wait. And then you see the pictures at 4 months, at 6 months, and it's amazing. Yes, the skin tightens up. Yes, there's things you can do to like enhance that process. You can massage them. You can, there's like a cupping method to kind of, there's things, a lot of women take collagen, although like work with somebody. I'm not saying just take collagen because that I have feelings about collagen. That's another topic. Things that help the skin tighten, quercetin, lysine, radio frequency, which is a non-invasive, laser current. It's not really a laser, but it's a treatment you can do that will tighten. There's a lot of things you can do. Exercise,
Well, there you go. That's my specialty. So what would your advice be to somebody out there that has been thinking so long and hard about getting breast implant surgery?
Well, I absolutely say do not do it. Absolutely not. I mean, it's like, would you tell your 12-year-old to like start smoking cigarettes? Like, even though like she might not get cancer, she might be fine. She might be one of those people who smokes her whole life and never gets cancer, never has a problem. Does that mean that cigarettes are good for you? No. I would never, ever suggest anyone get implants ever. And I would say that if the only reason that you should ever put a device inside of your body that's man-made is like if it's that or death. I mean,
like a pacemaker.
Like a pacemaker. And like I think about the Mirena IUD, which is made of silicone, and I think about penile implants, which are made of silicone. And I know that there's like a quality of life issue there for men. Like, and I actually dated briefly a rep for a penile enhancement device. And he told me like all about how much that, you know, it really makes a difference for these people. It changes the relationship. And I get that, but it's like, is your overall health going to be compromised as a result? And how's that going to affect your relationship?
Right.
Is it worth it?
Affect it big time.
You know, so now I think the harder question, there's two harder questions. One is, what do you do if you are a breast cancer survivor and you've had complete removal of everything and you have implants? Because that's what they do.
Right. They usually give you implants. Right.
Yeah. And in a lot of cases, texture, that's like a thing.
Yeah.
They use the texture a lot in cancer survivors because they have no breast tissue. So they think the texture is more natural.
Okay.
And that's insane now, right? Because now we know that causes cancer, specifically that type. Okay, so that's what's really hard. And I've had patients in that situation and they still take them out. So it's like, if you're a woman who wants to feel bad about having smaller breasts, but you're not a cancer survivor and you explant and you're like, okay, they're smaller and, you know, I don't like it. Just imagine where it could be. Like you could have literally like, and women are doing this and it's so brave. Like it's so inspiring to just kind of make that break from just being even part of that game at all. Just saying, no, I'm not even going to play that game. Like you're who you are and like your life, is so much more important.
Well, yeah. And I just think like the way I was thinking about champions the other day, I was thinking about how sometimes people, when they lose like maybe a leg or they can't do what they used to do, they have to retire. Let's say they're in the NFL or they're a wrestler like you. They think that they've lost that part of themselves and they have an identity. But you know what? They didn't, because what made them that champion is still inside. And what makes you sexy is not an implant. It is you.
Absolutely.
Yeah.
Yeah. And like the freedom to be able to move your body and feel yourself without that crap like disrupting is amazing. Like I hated my implants. Like by the end, I didn't even want them anymore, but I was never thought, oh, I'd just take them out until I learned, you know, that I needed to. But it feels so much lighter. It's just, yeah, it's really great.
And I don't think long-term that it actually gives people what they think it's going to give them. And, you know, it's temporary. It's a temporary, you know, high, I think.
Yeah. Yeah. And I think that that's a little bit of a problem, is that we're treating plastic surgery in this country now like just some fun, like high thing. And it's not. I mean, anytime you cut into your body, it's serious. I mean, scar tissue is a thing, you know, that affects like the chi, it affects the energy of the flow of everything. It can affect muscle patterns, like, you know, as an athlete, having a scar here, like I've had to work a lot on it because I already know it's like pulling me into a posture, like a forward posture, just the energy of the heaviness of that scar. So something you have to work on also, but yeah.
What would you tell your younger self, although you're pretty young? Like
I'm 30. I'll be 35 this year. I don't think I'm there.
What do you wish you would have known before you got implant surgery? Did you like to tell other women? Well,
in my situation, like I have a lot of gratitude for what's happened. Like this has created a new path for me. I had a really different life before I got sick. Everything changed. So I don't really like to look at it as a regret. But sometimes I wish I could go back to some of those darker years when I was really sick and tell myself that like it was going to be okay, because that's the real issue, is that these women are sick and they don't know.
They don't even know
why. And nobody has solutions.
Yeah.
Well, now they're starting to now, thank God. But you know, this is all new and like it's spreading like wildfire, but this is even just a couple of years ago. So, you know, I kind of wish that I hadn't been so in the dark. But I think I did the best I could. So, you know,
I think it's so amazing now that you know, got into a whole career. Mm-hmm. Can you tell everybody a little bit about that? Because I think that is an amazing story.
Yeah. Well, So I studied fine art in undergrad. I was an artist, and then I worked in fashion for many years, and I started a clothing company and in LA, and I worked doing like bottle service to like pay my bills. And we had like a startup clothing company, and it was fun. I had a really fun lifestyle. I don't think I was taking much serious like in life. I was just kind of doing like my like very self-centered lifestyle. And I just got implants just on a whim. Like I didn't even get very big ones. Yeah. Like it was just one of those things. I was like, oh, I'm 27. Like they're not getting any better. I didn't really like dislike my breasts. Like they were all right. They were just starting to get a little lower. And I was like, what do I do? And the surgeon was like, you just get a small implant and it lifts them. And I was like, okay. And after about 9 months was when I started having problems. So just everything in my life started to change. I couldn't stay up past 9 o'clock. Like I couldn't drink alcohol. So there goes going out. Like I had so much energy before that. I was like living on 2 coasts. I was flying every 2 weeks back and forth from Miami to LA, like working really hard, staying up till 6 a.m. working, then going during the day, doing this clothing line all day. Like I was shooting people, I was doing so much. Like I look back and I'm like, how was I doing that? And then it just overnight just changed. And I actually like was diagnosed with Lyme disease, but it was not like a real thing. Like I didn't have any confirmatory. I was just going to all these doctors trying to figure out what's wrong. And Lyme disease, like all the symptoms are like fatigue, body pain, brain fog, neurological, it was everything I had. But so I was like, okay, maybe I have Lyme disease. But I took antibiotics for 6 months, nothing helped. So I just started like thinking, okay, I was scared, but I thought I had Lyme disease. Just like, let me get really serious about health. Let me learn everything I can about health. So I started doing like green juice every day and just starting to add in modalities, like one after another to try to feel better. Just nothing worked. And like I said, I thought I had a musculoskeletal problem. So I went to chiropractic school and they were like, oh, you're going to have to work really hard because you have an art bachelor's. Like you don't have a science bachelor's. Like, are you sure you can do this program? And I was like, yes, I can do it. Yeah. And it was fine. I did it. It was great. I love science and I love the body.
Yeah. And it shows, this has been so informative today with, I mean, there's so much I didn't know myself and I'm sure in my area, there's several of us that had no clue that could be what's making them sick.
Yeah. Or just preventing like them being their best self. Because look at all the people who like we know. I love comparing this to drugs and alcohol because we all know people who drink and do drugs a lot, right? And they're healthy and they're fine, they're functioning, and they're like, what? Why can't I do it? I'm fine. And you're like, well, what could you be doing if you weren't drinking every weekend? Like, could you be an Olympic athlete? Like maybe. Like we all have different thresholds and potential, right? So like a lot of these things, like women are thinking it's aging. Like maybe I'm just aging. Maybe you're not aging. Maybe your implants are causing subtle problems. Like one of my close girlfriends ended up explanting because of me and like, I got her really involved. She had a baby. She gained a little bit of weight. She's like, I'm fine. I don't have any of the symptoms you're having. But she started learning about the ingredients and she was like, I'm not having another baby with these things in my body. So I'm going to take them out after I finish nursing. So she finished nursing. As soon as she took her implants out, like it was like her entire face lost like 10 pounds of inflammation. And she was shocked. She was just like in shock. Her body was like right back to what it looked like before. She used to like be a bikini model. She had a great body. And then after her baby, she still looked good, even with more weight, but it was incredible.
Wow. That's amazing. How quickly did you feel better after you got them out?
So it was like, I felt better right away. I had a lot of improvements right away that were measurable, like on labs, like my blood sugar went down. But then I started into this roller coaster of ups and downs for about a year where sometimes it was awful. And like anything that I did that was detoxing, like that I would do before to feel better, made me feel worse. And sometimes I would if I did I tried a couple like detox supplements and they just knocked me down for 3 days. Like I had migraines. but I've learned a lot through the process, and I've helped a lot of women. We typically do not put people on official detoxes right away, because the body just starts to get overwhelmed by detox as soon as you take them out. Because if you've been storing these things in your tissues, and then the liver is keeping up with like the daily assault, and then you take out the offender, then the body starts pushing all of the stuff that was in tissue out, and it sometimes can be overwhelming. So you have to optimize like based on your body individually, like what you specifically.
Did you do to chelate, like to get, like if you have like heavy metal? I know I had to do, or I did oral chelation, but some people actually go and
IV. Yeah. You did oral DMSA, or you did EDTA, or
it's called Natural Cellular Defense by Wayoria, I think I'm saying it right.
So chelation is a really complicated topic, and I do not think that chelation is right for everyone. And if the person is an autoimmune patient, we don't usually chelate them because it could be dangerous for their blood-brain barrier.
Yeah, I knew it was dangerous. That's why I was like, I'm only going to do the oral, because it was like this volcanic.
Okay, so you might have, I'm not super educated on that specific product, but
a doctor.
Yeah. So I would encourage everyone that wants to like look into that. And also heavy metal testing is a little bit of a challenge, because sometimes you can test and you'll see it's really high. You have to make sure that whoever does your test does a challenge. So you have to like work with somebody who knows what they're doing with the challenge. But just because you get maybe not super high heavy metal levels on testing doesn't mean that the amount of heavy metals you have aren't causing problems, because if you have MTHFR mutations, sometimes just that little bit of metal is not exiting, it's wreaking havoc. If you have mitochondrial defects, even a little bit of heavy metals can cause a lot of problems. It doesn't mean you need to chelate. I would just say there's a waiting game, there's a patience game, there's a trust in like the power of the body, that you are on the right track, that your body is made to heal, that we are made to regenerate. So you can incorporate external things, you can support that process, but you also have to trust in yourself and your body, that and have the mental stamina to push, to just stick with it and know that it's you're on the right track. This is like what I have to tell people. My patients, I tell them, this is a conversation we have a lot. Yeah, it can be frustrating.
I went to an internal medicine doctor, and he was holistic too. And so he basically tested hair and bloodstream and like different tests to see about how, where the heavy metal, how toxic, I had high levels. And he warned me of the dangers of the chelation. And I think that, like you said, it's something that you can't just dive into lightly. You have to do your homework and do your research.
Right. Yeah. And there's things you can work in, like alpha lipoic acid with the chelation. There's things that you need to that you can use to pull the metals out before they get chelated. There's a lot but chelation is just like one thing. It's not right for everyone. And there's many other ways to support detox.
But one big one is getting the stuff out, right?
That's step one. I mean, you cannot heal anything with implants in you. And I feel like there's a parallel to a vegan diet, because veganism is, and like, I do not like factory farming. But animal protein has a place, and unfortunately, a lot of it's really contaminated. So that's an issue. That's a separate issue.
It's not humanely.
Right. Right. Exactly. But it's like, some people can be okay on a vegan diet if they're not sick, if they don't have chronic illness, they can be okay on a vegan diet. I believe if you have chronic illness, it's very difficult to be a vegan. It's also very difficult to have implants. So it's like, once you get to that kind of more broken place, that's when like these things, there's nothing you're going to be able to do aside from explanting that's going to really get you where you want to be. It's always going to be swimming upstream. This is my opinion, but
wow. So I mean, this has been so good today, and I really think that people out there that may have had questions about whether their implants are making them sick are going to be a lot better informed, or people that have been thinking about getting implants may be deciding not such a good idea. So I think that it's always great to be aware and to get the knowledge and do your homework so you can be your best self.
Yes. Well, thank you so much.
And I just thank you so much for coming on the podcast, for being that light and that beacon. And, you know, it takes courage, and it took some courage for you to find your own solution and to have an explant, because, you know, that isn't something that you do lightly. That takes some courage, I think.
Yeah. It was definitely not. I'm going to write about it at some point. I'm going to write something.
Yeah.
I've been wanting to. So yeah. And I think everyone should do that. Like, write your story, because there's so many little details that get lost. And like, it's like really those small things, and women start freaking out right before. And like, there's a lot of fear and a lot of anxiety. And a lot of times their body's already in this hyper anxious state because of their implant illness, because of their hyper reflexive NMDA receptor, the calcium channels. Like, it's like these are things, heavy metals are causing this. And then you have to go through something really hard and you're compromised already. Yeah. The support group is really helpful for that phase. Like, I would definitely rely on the support group.
Well, I'll make sure to put all of this in the show notes. And if you have any added research, I'll try to grab that from you so that people can get a hold of that. And I just really thank you so much for coming on the show and just being a beacon and a light out there for women's health.
You as well. Thank you.
And thank you guys. Thanks everybody so much for listening. And make sure you put your questions on Facebook, and I'll reach out to Dr. Kayte if you have any issues or questions about breast implantation. Thanks, everyone.